The Digital Services for Patients and Public programme is going to help people access healthcare services in a better, more digital way. It will work with healthcare providers to make sure that those services are delivered well. It'll help improve the journey for the patients and for public, and help them to be able to monitor and manage their conditions better. The Primary Care Pathfinder project is looking specifically at the needs of the public and patients and their providers in primary care. We know there's been a really large amount of change in the last few years because of the pandemic, with new digital services coming on board, and we wanted to do a discovery to dig deep into what the experience of public and providers was during that time. Because as we go and develop more services, we need to be able to make sure that we've learned all the lessons from this time. Part of the Digital Services for Patients and Public programme is developing the NHS Wales app. As I said, we really wanted to look at how primary care were experiencing changes in digital delivery over the last few years. So we needed to get on and do this work really quite fast and in a very skillful way, and that was why we were very glad to be able to work with the Centre for Digital Public Services, who were able to stand up very quickly a really expert team. We had a service designer, user researchers, a delivery manager, and over a really intense period of about 12 weeks, it extended a little bit because of COVID, we were able to get speaking to more than 20 GP practices, about 14 members of the public, and really dig deep into their experiences through very, very detailed interviews so that we could understand what was going on. And we also did, the team also did a very wide set of stakeholder interviews so that we had the policy context and the wider stakeholder context for what had been happening in primary care during this time. GP practices have always tried to be as flexible as possible to meet the needs of their patients, and in that sense they have been user-centred. But things have got a lot more complex. The changing model of the delivery of primary care, the workforce issues, the pandemic, the rising demand that we don't fully understand, all of that has led to a great deal of complexity, and it has been challenging for practices to deliver within this space and also for the public. Whilst patients have understood that the way that general practice and primary care is being delivered has changed over the pandemic, now we're at a time where we're thinking, how is it going to be in the future? What's this going to look like? Where can we pick some of the digital tools and approaches and make best use of them to be able to manage this challenging time that we're in? So the next steps for us is to take our really detailed report and work with some of the stakeholders to be able to agree what our next steps are. It's been great working with the really expert team from CDPS who have brought their skills to this project. But it's worth saying that it's also been really good to have the training courses for the existing staff in our public sector organisations so that they can develop those skills and be able to form multidisciplinary teams doing great digital delivery for Wales.